Alright, so the scenario I chose is going to be 1A. We have a foolish incident on ice. Patient has come into the clinic thinking that we can just fix it. However, the patient has some major bruising, swelling, and crepitus, as well as they have a loss of strength and are unable to close their fist. So first things first, I'm going to be checking the scene. We are in my theoretical clinic right now, so the scene has been checked. We are in a safe space. We're not concerned with anything majorly bad happening within this clinic itself. So I'll be coming up and I'm noticing what's going on. I'm looking for discoloration, swelling, edema, anything like that, or major deformities. I'm not seeing any of that. However, there was the crepitus that was noted. So next I'm going to come in here for circulation. So by moving the hands, I'm just pinching each individual finger, looking for notable recirculation. It should change from white to red if the circulation is done properly. Next patient, can you close your eyes for me? Can you tell me where on your hand I am touching currently?
Fourth finger again, inside, index finger on the back.
Good. Good. Can you open up your eyes? So I'm checking for any sensory deficits or anything like that. I'd also be taking vitals. For this scenario, I'd take vitals on the left hand, just blood pressure. I'd also be looking at respirations as well as the beats per minute, just to make sure we're ruling out any other major thing that could be going on or ruling out that the patient is in shock. Next thing, we're going to brace this wrist, because after this we're going to be sending the patient over to the ER for x-rays and probable actual squinting. So this is likely going to be a wrist fracture. So I want to make sure that I'm going to be crossing this wrist joint. So I'm measuring out here. And then due to how this is, with how his hand is presenting right now, my goal is going to be just to hold it in place as much as I can with as little movement as possible. So I'm going to be bracing on the outside here. If he was able to rotate it better, I would be bracing on the inside here to make it just a little bit easier, but because he's not, we're going to brace through the palm of the hand up to the elbow. I'm crossing the wrist joint, but I'm not going to cross the elbow joint. There is no open wounds or anything like that, so I don't need to use too much PPE. I would be wearing gloves in this scenario and a mask if we're still in the COVID times, which we are. So I would be wearing a mask as well. But there are no open wounds or anything like that, so I'm not concerned with getting any bodily fluids getting stuck on me. I'll have you hold that just like that. So we're going to be coming through. I'm going to be wrapping fairly snugly all the way around, making sure to not lose any circulation through and let go. So the idea here is to stabilize this wrist as much as we can to prevent any further damage occurring at the wrist, as well as to prevent any possible sensory or circulation issues from happening, since they have not happened quite yet. Feel stable to you?
Mm-hmm.
So at this point, the patient's wrist has been stabilized. We are crossing this joint. He shouldn't be able to move it, and we are good for transport. If the patient is capable and has somebody with them, I would say that the other person can drive them to it. Otherwise, 911 if they are by themselves, to have the ambulance bring them towards the nearest emergency care clinic that they can be at.